So in looking at medical problems, this was a publication that came out of an Academy of Osseointegration summit that we looked at specifically systemic disorders and medications on implant osseointegration. And we mostly focused on osteoporosis and diabetes because this was really what the literature mostly showed in terms of evaluating these implants. We also looked a little bit more minorly at some of these other aspects: neurocognitive disorders, cardiovascular, HIV, hypothyroidism, and autoimmune diseases such as rheumatoid arthritis. And then we looked at certain other medications like SSRIs for depression, proton pump inhibitors for acid reflux, and antihypertensives. And so we looked mostly, the systematic review really could only be done for osteoporosis and diabetes, and then we have some preliminary information about the other diseases and medications that I mentioned. And you could see we looked at quite a lot of literature and ended up with 22 studies, both in patients that were taking anti-resorptives and not taking them for osteoporosis. Now, I think the further along that we get in looking at literature, we're really going to find very few studies to evaluate osteoporotic patients that are not on anti-resorptive medications, because most of them really are nowadays. And we know that osteoporosis and implants, there is some controversy in the literature. Is there an association between bone mineral density and implant survival? Some studies say no. Some studies say that there is either a weak association or even some association. So really the literature is conflicting, and I think it's very important, because as our patients get older and older, there are going to be more and more patients that are osteoporotic that are seeking implant therapy, and so we do have to have more information in the literature. So I encourage all of you who are out there and do a large number of implants in this population of patients to think about really evaluating your data, maybe recording it in Osstell Connect as Will Martin's going to talk about a little bit later, but really to generate more and more data and have these large databases that then we can analyze, and we can pool all of that data together and get really valuable information that's going to help all of our clinical practices.